Welcome to the Dose of Optimism, where I talk to the optimists in healthcare. My name is Omkar Kulkarni, and I work at one of the world's best children's hospitals where I lead innovation. I started KidsX, which is a premier international startup accelerator for pediatric innovation. And over the years, I've met thousands of startups, investors, and innovators. Every one of them has a story, and every one of them is optimistic about the problems they're solving. On this podcast, you'll meet amazing people who will share their stories and what makes them optimistic about the future of healthcare. A little note before we get into this episode. This podcast is for informational purposes only. We are not offering medical advice, and we're not endorsing any products. Please talk to your own physician about your health or the health of your children. All right, let's get started. Innovation in healthcare often involves the use of digital technology. So far, we've talked to entrepreneurs from small to mid-sized companies who have built technologies solving for specific problems, ranging from school-based telehealth to medically tailored groceries to autism therapy. But any discussion about digital innovation is incomplete without talking about the lifeblood, the central nervous system of a modern-day hospital or clinic, the electronic health record, or EHR. Use those letters with anyone who works in healthcare, and you will immediately spark a conversation. The healthcare delivery industry has undoubtedly transformed since 2009, the year in which EHR adoption dramatically changed across the United States. That year, fresh off the financial crisis of 2007 and 2008, the federal government passed the High-Tech Act. In an attempt to stimulate the U.S. economy, the government believed that financially incentivizing hospitals and clinics to implement electronic health records would result in jobs and growth in better healthcare delivery. In 2009, prior to the High-Tech Act, approximately 6% of hospitals had fully implemented EHRs. A few years after the Act's passage, in 2015, approximately 80% of hospitals in the U.S. had fully implemented EHRs. As an example, many hospitals received somewhere between $44,000 to $65,000 per physician on their staff as an incentive to implement this technology. These financial incentives paved the way for rapid, wide-scale adoption of EHR technology, from rural clinics to massive academic medical centers. Today, children's hospitals across the United States use EHRs to coordinate care between doctors, nurses, and pharmacists, to access the same up-to-date patient data, reducing duplication and errors. The EHR can make patient care safer by alerting doctors for potential allergies or critical lab values. It enables billing and charting through the documentation of critical information that takes place during a hospital or clinic visit. And the EHR offers a portal for patients to access their medical chart, schedule appointments, and ask their providers questions through video visits and asynchronous messaging. Hospitals have robust plans to protect their cybersecurity of their EHRs and have contingency plans for when the EHR is down for any reason. It truly is the central nervous system for a hospital. Today, over 15 years since the High-Tech Act, almost every hospital or clinic in the United States has electronic health records. Major technology companies like Athena Health, Allscripts, Meditech, Epic, and Oracle dominate the market. In this episode, we dive into Oracle Health. Let me read this to you from their website. Oracle Health supports providers, payers, and public health organizations with a secure, comprehensive suite of cloud-based solutions. Built on enterprise-grade infrastructure, their unified solutions help safeguard patient data, streamline operations, alleviate administrative burden, and deliver near real-time insights for connected, efficient care. AI is embedded into every layer of their technology, from their data platforms to their cloud applications, providing actionable insights that help deliver efficient, enhanced care. And it all runs on their secure, scalable AI infrastructure built for the demands of healthcare. So I sat down with Dr. David Feinberg. He's the chairman of Oracle Health and Life Sciences. Previously, David served as the president and CEO of Cerner, which is now Oracle Health, where he led teams delivering tools and technologies to improve the patient and caregiver experience. David is a pediatric psychiatrist, which we're going to talk about during the episode. David built his early career around helping children and families. He served as the president and CEO of both UCLA Health System and Geisinger Health, prior to assuming leadership of Google Health in early 2019. So at UCLA, he was focused on the patient experience, and he increased their patient satisfaction scores from the 28th percentile to the 99th percentile. At Geisinger, David led a complex turnaround that made Geisinger one of the nation's most innovative healthcare providers. They were the first in making DNA sequencing a routine part of patient care. And at Google, he brought their healthcare division to the forefront of using artificial intelligence and mobile platforms to improve healthcare. David began his career at UCLA researching and publishing in the areas of addiction and ADHD. I've seen that he has focused a lot of his work on making healthcare more accessible, affordable, and equitable. I hope you'll enjoy this interview with Oracle Health Chairman Dr. David Feinberg. Dr. Feinberg, thank you for joining us.
Oh, my pleasure. Excited to have the conversation.
So, you're a pediatric psychiatrist, and you've led so many major influential organizations like UCLA and Geisinger, Google Health, Cerner, and now Oracle Health. What thread connects all of these roles for you?
For me, it's still about making it easier for patients and families and young folks to get care that's understandable, accessible, care that I'd want for my own family, or when I was practicing, care that I hope I was delivering to patients and families.
So someone once said to me recently, once a pediatrician, always a pediatrician. And I imagine that may hold true for you. With your pediatric and adolescent background, how has that helped shape Oracle Health's approach towards pediatric care?
So it's a fascinating area when you go from a subspecialty to kind of general medicine. You're kind of always looked at like, hey, are you going to be good to child psychiatry? Are you going to, remember us and all that? And I just think our medical specialties are broken apart in kind of an awkward way. Patients and families have all kinds of issues. All cardiac patients have mental health issues. Mental health doesn't protect you from pulmonary issues. Like, these are people that we have the privilege to care for at different stages of their lives. And what I really learned as a child analysis psychiatrist is how particular illnesses, in this case, mental health, can affect families and siblings and parents and what it does. I mean, I used to say when your kid has cancer, people bring food to your house. But if your kid's flapping in the supermarket because they have autism, people go to a different aisle. So mental health to me was always this place that didn't get the same attention. Some of that has changed. I think we've made progress, but not huge. But regardless, those are families that need help. So I think my background, and I hope it's comes out in Oracle and Health Life Sciences, is that we want to take care of everyone. And we're going to take care of everyone in a holistic way. And everyone actually not only just means patients, but it also means caregivers and billers and coders and everyone that's involved in this healthcare ecosystem. And I think that's why I'm so excited about what I'm doing in Oracle.
That's great. I agree. I think there's so much we can do as we think about whole patient care. And I think technology is a great opportunity for us to advance some of that. The worlds of healthcare and artificial intelligence are quickly coming together. And from what I've been reading, Oracle Health has big, bold plans in this space. So I like to play this game. Let's fast forward 5 years. Let's say it's now the year 2030. What would a pediatrician or a pediatric specialist who uses Oracle Health in the year 2030 say that they love the most about the technologies they're using?
So I think it's going so fast that I'm going to change your question to what would a pediatrician say in the year 2026? So what they're going to say is, this is amazing. I'm going home earlier. I'm spending more time actually seeing my patients. I'm not spending any time looking for information. I'm getting great insights and nudges that are allowing me to treat better care of my patients, and have been unleashed from the computer. Right. So I think that our ability now, using AI in our new ambulatory EHR that works great in pediatrics, allows you to say, hey, Oracle, tell me about my next patient. And not only does it comb through the record of multiple EHRs through health information exchanges, but takes 2,000 public data sets and brings in other really important information that's not in electronic health records. Like, I'm in Los Angeles right now. I went to the doctor a few months ago. It would be good for the doctor to know that I was exposed to fire, but that's not in the EHR, or that I come from an area where there's issues around food. That's not in the EHR. So that information plus the electronic health information. So then what if I was the pediatrician going to see the patient, I say, tell me my next patient, and it gives me that great medical school student summary. Here's what's going on with your patient. Here's why they've come in. Here's when you saw them last, and here's what you need to do. And then with permission of the family and the patient, I'll see the patient and literally never touch the computer. Not only does the ambient do the scribing for me, but it also tells me the denial-free pathway. Hey, if you do this, it'll be approved automatically. Let's say physical therapy for back pain instead of an MRI, or this medication is first line and improved in this case. The claim will be adjudicated automatically, and the patient will feel like they've really been understood. They won't get questions like, hey, did that test result come back? Or what did Dr. So-and-so say? Or in the inpatient setting, we've all been there where it's like, you're going home today. No, you're not going home today. Yes, you are getting an MRI. No, you're not getting MRI. The digital coordination allows communication to happen so everyone's on the same page. That kind of magical level of AI at every level is what we've built and will be done with the acute setting in next year. The ambulatory's done. So I don't think we're waiting to 2030. We are already hearing from clinicians. I saw 300% more patients in the ER. I'm not retiring. I saw 2 more patients on average per day, and I have no pajama time. So this stuff is happening today. I think if I really tried to answer your question in 2030, it's hard for me to imagine with the acceleration that we're seeing right now with these large language models. But I imagine it will be things like, hey, we think in your visit you could have done something a little differently, or this patient may be really appropriate for a clinical trial, and we can bring the trial right to you, and you become the principal investigator, and you're in rural California. So I think we'll continue to see that acceleration, but that, back to the future is actually, we're living it right now.
That's really exciting. So let's dig in a little bit here. So let's just say the next year, your 2026 vision, that's a tremendously positive and amazing vision, and magical, as to use your word. It's also a lot of change. You and I have both worked in healthcare and health systems. Change in health systems can be challenging. Adoption, which I'm sure is key for a lot of this, is going to be crucial. What is change management going to look like as we think about going from where we were a few years ago to what is technically possible, perhaps, with Oracle Health in 2026?
Yeah, I don't think we're talking about rip and replace. And I don't think we're talking about, I remember when I was at UCLA, we did the largest Epic install ever at that time. It was inpatient, outpatient, and rev cycle. And we took over a restaurant that had just moved out. It was Olive Garden. And we made Olive Garden our training center. And you went there for weeks to get trained to use the system. Those days are over. Well, I don't know about Epic, but I can tell you those days are over for Oracle Health. It literally does not require, it's just intuitive. We just literally put the system out. We watch how people use it. We built it with really great input from frontline clinicians so that it's intuitive. The same way you don't get trained on new software when the app upgrades on your iPhone or your Android. It just works. And so that's the same kind of consumer mentality that we brought to this endeavor. So it isn't back to Olive Garden for weeks of training and certification. It just works in your workflow, and it's intuitive.
So less training required, and it arrives and allows people to use it and play with the technology and get better at it at an individual level. Is that right?
Yeah, absolutely. And it's iterative. And because it's all cloud-based, you continually just get updates, or let's say quarterly get updates. So we don't have to wait for things to happen. It happens automatically. It isn't like separate configurations at different places. It's the same code, and it might be, you might be able to configure at the edge, but the code gets the continual upgrades. So it's way different than what we were doing in the last literally year or two, when we had different instances at different places, and it takes 6 months before that upgrade takes place.
And now a thank you to our generous sponsors.
All right, we want to thank our sponsors for A Dose of Optimism. Our first sponsor is Nabla. Nabla, this will help keep us practicing longer. For 85,000 clinicians and counting, Nabla is the key to better balance. With real-time notes and dictation in one platform, clinicians are saving hours on documentation time and strengthening patient satisfaction. Learn more on nabla.com. And to Mercury Bank, online business banking for startups and small businesses. Go to Mercury Bank for powerful banking, simplified finances. And finally, we want to thank our presenting sponsor, KidsX. KidsX is a global ecosystem of pediatric innovators anchored by a consortium of the leading children's hospitals motivated to accelerate health innovation and transform care in pediatrics. So with clinicians using AI, there's a huge question around trust. How do you trust the output that the AI is producing? How are you thinking about instilling trust around AI outputs that will come out of Oracle Health and clinician facing, just so that people can start using them without having to continuously double and triple check the work?
Anytime we use AI, we tell you the source where we got it. So if I'm getting a history of present illness on a patient that was, computer generated for me, I can click and I see where it got the information. So there's a transparency to it. But we're also building this open, connected platform, which allows you as a provider or you as a health system to build your own AI agents or use others.
It's going to be a fun journey to go from where we are now to where we're getting to as a healthcare delivery system. What about patients and families? So in the pediatric sense, you've got parents, you've got caregivers, you've got sometimes adolescents that are accessing the record, the portal, and I think the new patient health record that Oracle Health is building. How will AI be built in there, and what's the magic that you're seeing will happen in the future there?
Well, the one that I'm most excited about is kind of that concept of consumer grade instead of healthcare tech. So if you're on any other electronic health record and you have an appointment next Wednesday at CHLA, you get a text that says, you have an appointment on Wednesday, you can press 1 for yes, 2 for no, and 3 to reschedule or something like that. We said, no. We want people to write anything they want. And patients are writing back, I need the blue pill. Patients have written back, I'm not sure I want to vaccinate my kids. I got back pain. I have this question. Can I change my appointment? And AI agents figured out the blue pill was actually not for the doctor you're seeing next week. It was from a specialist who happened to be on vacation, and 3 sentences get sent to the covering specialist to get the blue pill refilled. So think about, I always say if you want good healthcare, you need a daughter because that's who manages healthcare for the whole family. Or in your case, it's
I have 3 daughters, so I'm in good hands.
there you go. See, you're good. But in your case, in pediatrics, it's always that super mom who takes care of everything. Not necessarily because they want to, but because no one else seems to step up. But so think of that AI agent taking care of scheduling, refills, appointments, all on behalf of you or your child. That's you can now focus on the child's medical condition and not carrying around binders of papers and having phone numbers and talking to your insurance company. All that stuff gets taken care of. It is a huge, huge relief for families to be able to focus on the medical issue and not the medical process.
So a couple questions. How far off is that supermom away from having that access? And if supermom speaks Spanish, is that going to be available in multiple languages, or where are we at with both of those things?
Yeah, the Spanish is no problem. So the AI agents can be, multilingual. Not only that, if that mom has a sister who's a nurse and wants a note written to the sister, we can do it in a higher education level based for a nurse. So you get the AI stuff is amazing at languages and all that stuff. How far are we? So it's been in beta testing. It's in production with all of our partners. So if we go back to your question, for sure 2030, but I would say by the end of 2026, all these things that I'm talking about will be available to all of our customers.
And this would be through the portal that accompanies the Oracle Health record?
Yeah. So when you really think about it, it's all the same data. It's data that sometimes my insurance company needs to see. Sometimes I need to see as the provider. Sometimes I want to see as a patient or a family. I always say people don't want their medical information. They actually want knowledge. I don't want my labs. I want to know what's my bad cholesterol. So that data and that AI layer and that semantic layer is what we have built and is now available across the board. And it's just really how you think, or it could be somebody running a department of health or a health system or a state or a country, you know, being able to see data in ways that allow them to do what they need to do. And that could be on the provider side, the patient side, the payer side, the government side, of course, with all the privacy and privileging.
I was talking to a dad recently, I guess a super dad in the way we're talking about it. And he's got a kid with complex needs, and he's saying that, he's trying to get answers and information about her care and her record. So he chose to put some of her health record into ChatGPT like interface, and he's asking it questions and kind of treating it as an agent, which is not something we're looking to do because of privacy issues across the board. But is that something that an Oracle Health could do in the future, where a patient could ask questions of the health record and it provides answers? So beyond the agentic, more of a search and summary type of tool, the way people are using ChatGPT.
Yeah. So if you look at all those large language models, they're all running on Oracle, whether it's Gemini or ChatGPT or Grok. And it's the Oracle Cloud has some unique features that I think make it really great for AI. And then if I'm that super dad and I have a question, not only could you get access to that type of information, but we can run it on whatever model is best for that query, because it may be a different model for you as the clinician thinking, well, maybe I'm not making sense of this diagnostically. Could this be this? Or, let me put the labs in, et cetera. So yes, in a private, secure way, super dad and super doc have access to that AI to help them iterate on questions, concerns, all of us that have used the ChatGPTs of the world, is pretty amazing the kind of stuff you can get at. It's way better when you have way better. It's good English. It is much better when you have more data, and a lot of data is private, but that dad has access to his child's private medical record. So it makes it an even better answer. And then we can use whatever model would be appropriate for that query.
That's great. So with pediatrics, beyond mom and dad or parents or caregivers, there's also schools, there's also regional centers, there's other care providers that need to be able to access and perhaps interact with a patient's health record so that the child can have continuity of care and information across various care settings. They may not necessarily be a doctor's office or a hospital. How are you at Oracle Health thinking about that in terms of the future and how to connect these data sets, not only from a kind of unilateral perspective, but perhaps even in the future bidirectional, so that everyone's contributing to the same information, the school nurse, the regional center, et cetera?
Yeah, it's a great question. We actually think that pediatrics and mental health does it better than the rest of healthcare, and we're bringing some of those practices from pediatric behavioral health into the rest of healthcare. So when it goes wrong in the hospital, in an adult hospital, it's probably pediatrics too. I always say it's one of two things, and sometimes both. It's coordination and communication. Like the teams weren't talking to each other, or they didn't coordinate how to do it. And we've all been in that hospital. Oh, you're going home tomorrow. No, you're not going home tomorrow, et cetera. And in behavioral health, we always had this mastered treatment planning where we would get everyone together. This would be an inpatient setting, but I'd have the school teacher, the OT, physical therapy, the parents, the step parents, the psychologist, the rec therapist, the psychiatrist. And we say, okay, now we're talking about the depression. What are we doing? Now we're talking about discharge planning. What are we all doing? You got people to actually coordinate and communicate care, and it was incredibly effective. We've built that in now digitally on our acute care side. So instead of nurses writing in nurses' notes and doctors and OT, anyone who's talking about the patient's hypertension is communicating in the same spot. And then if we're talking about discharge planning, we're all writing together in that same spot. So we really do think that that is the beginning and then foundation. And then Oracle is open and connected. So if you're not in that acute setting, we have open APIs that would allow, with the permission of the family, of other folks to read right into the record. So the school teacher could see exactly what's going on. And hey, I want to know what the school teacher thinks. I mean, that was, as a child psychiatrist, that was like 90% of my job. It was, hey, how's it going in school? And how's it going at soccer? Well, we think digitally we can help facilitate all of that. So yes, we bring in about 2,000 public data sets in any patient that's coming in. So we do have that unidirectional, but that bidirectional allows us to then, with permission, share that data with people that are really important for that child's care.
I have a moonshot question for you. If you could redesign one aspect of pediatric healthcare from scratch, what would it be? And is there a way Oracle would help in that?
So I'm going to answer a different question. I think that pediatricians have been amazing at saving kids' lives by saying, wear your seatbelts and put on bicycle helmets. Like, beyond, antibiotics and clean water. Like, think of that change. When I grew up, we just would wrestle in the back of the station wagon. Like, seatbelts weren't a thing. And now no one gets in a car without putting their seatbelt on. That was pediatrics. And I've always wanted child psychiatry to come out with their bicycle helmets and seatbelts to prevent what we know is bad outcomes because kids are exposed to, adverse childhood events, or what it's like to grow up in a family where you're physically or sexually abused and those kinds of things. So if I could do anything, I would copy pediatrics and bring it to mental health and say, yes, we're good at treating ADHD and we can treat anorexia, but why aren't we screaming like the pediatricians did about seatbelts and bike helmets? And we have our own that would fit into that category. So if I had my soapbox, that would be it. Is Oracle Health doing it? Hey, in Qatar, they use pediatric weights to determine whether, on our electronic health record, whether they're going to build a gymnasium or allowed a fast food restaurant to open. I'm like, that's amazing. So, kids' weights are too big here. We're not going to put a restaurant, but we would approve a gym. So we are doing it. I wish I could say we're doing it around the whole world, but there are definitely examples where you see that kind of mindset around pop health in pediatrics and technology all coming together.
A really interesting example, connecting the individual health with public health and population health. It's a great example. So a couple quick final questions. If Oracle Health were a superhero, what would its superpower be?
I think if we were a superhero, we would have instant insight and we would help facilitate intervention. So the doc would go, oh, yeah, this makes sense. And then it magically would make sure all that stuff happens.
What's a book or movie that's recently inspired you?
I like Peter Attia's stuff. Outlive has been kind of one that I've been paying a lot of attention to recently.
And then in line with your seatbelt story, what's one gadget or app you wish existed for your parents?
I think smartphones. You mean that they had been able to grow up with?
Yeah, that's really interesting. And finally, last question, what makes you optimistic about the future?
I am so wildly optimistic, but that's probably a character flaw that I have. I'm always optimistic. I think that, we've always talked about healthcare is too big of a percentage of GDP and we got to get it better. And I think there is movements now around people being healthier, around technology actually helping facilitate that. And I think we could get to a point where we're able to care for more people with higher quality and decrease the cost. So, and I hope we're part of that.
Dr. Feinberg, thank you so much for joining. Our podcast is called A Dose of Optimism. So your optimism is felt and appreciated on the podcast. Thank you.
Hey, thanks for doing this and thanks for having me.
All right. Thank you for joining us for your Dose of Optimism. Make sure to check out our show notes to get more information about our guests and the work they're doing. Visit our podcast page on the KidsX website to join our podcast community and to learn more about pediatric innovation. Thank you to our sponsors and to our presenting partner, KidsX. Please subscribe wherever you get your podcasts, and remember, it takes a village to make sure our kids grow into healthy adults. So volunteer at your local library, help out at the community center, and thank your crossing guard. And if you're so inspired, donate to your local children's hospital. All right, see you next time.